Now that we understand the concept of normal variation, let's take a look at oral tissue under white light and VELscope VX. This is a normal floor of mouth. Sometimes the area around the sublingual gland can be well vascularized and can lead to a loss of fluorescence that represents vascular variation and not pathological change. On the other hand, the floor of the mouth is a common site for development of oral dysplasia and oral cancer in patients with a history of excessive use of tobacco and alcohol. That area deserves careful visual and VELscope VX observation. Sometimes a normal oropharynx can host varying numbers of lymphoid aggregates, which, due to tissue structure, display a pronounced loss of fluorescence that does not signal serious pathology. On the other hand, a patient with a history of risk factors such as tobacco, alcohol, STDs, or immune system suppression is at higher risk of malignant disease of the aerodigestive tract, including the oropharynx. The presence of an irregular zone of loss of fluorescence should never be ignored. Pigmented tissue, such as this example of an amalgam tattoo, appears dark under both white light and VELscope VX. The buccal mucosa is a common site for irritation and consequent inflammation. Inflammation always shows a distinct loss of fluorescence because of increased blood content. The intense inflammation associated with erosive lichen planus results in a pronounced loss of fluorescence. Note the hyperkeratotic area on the ridge. If this lesion showed increased fluorescence, it would most likely be a simple case of uninflamed hyperkeratosis. In this example, however, the area shows a strong loss of fluorescence and is, in fact, dysplasia. If a suspicious area is discovered, re-evaluate under white light and VELscope VX, trying to identify what might have caused the region to appear abnormal. Take into consideration its appearance under both VELscope VX and white light, its response to palpation, as well as patient history information, including risk factors.